So now we shall have a discussion on this question. Most of you have committed a mistake, and it's a straightforward MCQ based on the immunization protocol that has to be followed in a splenectomy patient. So it's mostly a memory based question and direct pickup line from Bailey and Sabiston. So let us begin with what all that's required prior to splenectomy. So basically you need to provide a immunization protocol, as well as you need to provide a antibiotic prophylaxis after surgery. Let's begin with the immunization protocol initially. So 4 vaccines that have to be given before elective splenectomy. Those include pneumococcus, meningococcus and Haemophilus influenza, as well as routine flu vaccine, that is the influenza vaccine. So the pneumococcus and meningococcal vaccine have to be given every 5 yearly, and the Haemophilus influenza vaccine to be given every 10 yearly, and the influenza flu vaccine has to be repeated annually. So this is the protocol that has to be followed after splenectomy. Prior to splenectomy, when and what is the exact point at which these vaccines have to be given is always and most frequently asked MCQ. So here there is a slight difference between Bailey and Sabiston. Bailey 28th edition, it mentions that these vaccines have to be given 2 weeks before an elective splenectomy, whereas Sabiston says, as you can see here, it is ideal to give at least 10 to 12 weeks before splenectomy, or a minimum of 2 weeks. I have gone through the Shackelford textbook as well. So the ideal case scenario, it's always better to give these vaccines a minimum of 10 weeks before splenectomy, so that it elicits a good antibody levels. So the more the duration that you give the vaccination before the splenectomy is done, the better is the outcome of the antibody levels. So the same you can see here. In a case of emergency splenectomy, the recommendation is that you can't give it 2 weeks before splenectomy. So in case of emergency, the recommendation is that you have to give as early as the patient gets stabilized after surgery, or at least before he goes on discharge, or before within a minimum period of 2 weeks from the time of surgery. So at least minimum 2 weeks before within the time of surgery, you have to give the antibiotic, give the vaccination, so that he develops an adequate antibodies. And the amount of antibodies that are produced in a patient who has underwent an emergency splenectomy and received the antibodies is almost 50% lesser than those who have undergone a splenectomy and received elective splenectomy and received these vaccines pre-operatively. So take home point is that ideally in a elective splenectomy, vaccination to be given 10 to 12 weeks before, or at least 2 weeks before the elective splenectomy surgery. If it's an emergency splenectomy, give as soon as possible when the patient becomes stable after surgery, or at least within a period of 2 weeks from the point of surgery. So these are the points that are given in Bailey and Love. And apart from that, how frequently these vaccines have to be repeated is, for you is a simple mnemonic that I can give you. For pneumococcus and meningococcus, you need to repeat them every 5 yearly, just like the elections in India. The PM is elected every 5 years. So just remember with this mnemonic, pneumococcus and meningococcus 5 yearly, and Haemophilus influenza, it has to be given 10 yearly, and influenza's flu vaccines have to be given annually. So these are the points that mentioned in Bailey Love. Apart from this, a couple of other points have been mentioned. That is, pneumococcal vaccine, it is given as a 13-valent vaccine initially, followed by a repeat dose after 8 weeks, which is constituted by 23-valent pneumococcal polysaccharide vaccine. Apart from that, Haemophilus influenza is a quadrivalent vaccine, and meningococcal you give a monovalent vaccine. So one more additional point that you are learning here, apart from what's given in Bailey, is that pneumococcal vaccine initially you give a 13-valent, followed by a 23-valent vaccine 8 weeks later on. So that's one point. And the other point that's additionally given in Sabiston is that ideal duration before prior to surgery is minimum of 12 weeks is a good point before the surgery where you have to give the vaccination. So this is all about vaccination. And now let us see about the antibiotic prophylaxis that has to be given after splenectomy. So 3 take-home points regarding antibiotic prophylaxis is that for any child who has undergone splenectomy before the age of 5 years, he has to be treated with a daily dose of penicillin till the age of 10 years. This is the point 1. If the child is less than 5 years and undergone splenectomy, continue the antibiotic prophylaxis till the age of 10 years. And if the child is an older one, you have to continue the antibiotic prophylaxis till the age of 16 years at least. After which you can discontinue and you can place the antibiotics SOS as required. And the third scenario is that in a person who is immunocompromised, he has to receive the prophylaxis on daily basis irrespective of the age. So these 3 are the precautions that have been mentioned for prophylaxis. A child less than 5 years undergone splenectomy, continue to the age of 10 years. For an slightly older child, you continue till the age of 16 years. And for immunocompromised child, irrespective of the age, you keep on continuing the antibiotic prophylaxis. So 2 points: vaccination protocol. Second is the antibiotic prophylaxis. And remember the mnemonic: P and M is repeated every 5 years, Haemophilus influenzae every 10 years. So I hope you will not commit a